For the last year, our cameras have had special access to one of Britain's largest cancer centres.
Good morning, Velindre Hospital. Can I help you?
We've seen the life-changing challenges faced by patients and their families.
It's been a bit of a worry for you and mine, hasn't it?
Yeah.
And the passion and expertise of the army of dedicated staff.
There's something unique about working in Velindre.
And that makes this a pioneering, world-class facility.
Velindre is one of the leading lights in the world for oncology and for palliative care.
From heartbreak...
Come on, then.
...to hope.
You have to go to a diet like the rest of us.
This is the story of a place where few of us in Wales would choose to spend time.
I'd quite happily be famous for anything else, really, than being a very positive, ill person.
And yet it really is one of our national treasures.
This is a miracle place.
Yeah.
You can feel the hope within the walls.
Our modern lives in Wales. Every day packed with pressure, each night filled with distractions. If you're healthy, life offers so many choices. It's easy to forget that there's one thing none of us can avoid. But when you fall ill, reality hits home.
It was walking into Velindre that first time that it sort of punched me in the face that this was for real, this was actually really happening. And that's where my world started to sort of turn upside down a bit. Life is so precious. You don't really realise it until you think it's going to be taken away. To put it bluntly, I didn't think I'd see this Christmas.
Kevin and his wife Sharon are here for an update on the treatment he's having for cancer of the esophagus. He's already had major surgery, which has involved stretching and repositioning his stomach.
So Kevin had a locally advanced cancer affecting the gullet, the food pipe. And what we mean by that is it was quite a bulky tumour. It had spread into the surrounding tissues, but hadn't spread to further parts of the body. So we were hopeful that we would be able to embark on a potentially curative treatment for Kevin. The treatment was very arduous. He had to undergo courses of chemotherapy both before and after what was a major operation.
Kev, come on, show me your scar.
No!
Come on, show me. Come on. Oh, wow. It's amazing, isn't it? Look at that. Fact is, you haven't got a stomach there. There's no stomach. Can't believe that, can you?
I used to have one.
I know.
Kevin's recovery from surgery was accelerated by visits from friends and relatives, and no doubt by his own wry sense of humour.
Well, that was...
This is when the girls came in.
Sarah and Rachel.
Yeah. But instead of saying, how are you, Kev, they were watching the air ambulance arrive because my window was right up looking over the helipad.
I know.
I know you know, but they don't.
For some patients, the hope that Velindre offers is about quality of life, being able to enjoy the time that's left, and not about eventual recovery.
When you're diagnosed with stage 4 bowel cancer, it's usually about sort of 3 to 4 years life expectancy. So I am kind of on the edge of that now.
Alison Edmund, please.
I suppose I'm defying the odds a bit at the moment. Hello. Hi, I'm all right, thanks.
Alison has set her sights on a big date that's still 6 months away. Her 30th wedding anniversary is coming up, and she's determined to mark the occasion with a grand party and a new wedding dress.
People expect that when you have cancer, it's a very desperate situation. You should be sad all the time, and you should be upset about it. But actually, I'm not as stressed as I used to be. I don't stress about the small stuff anymore.
Absolutely, wow.
I used to focus very much on work, my career. Everything had to be right about that. Now not working, I'm a much calmer, stress-free person, and I didn't think that would happen. And people will, you know, think I'm a bit odd for saying this, but actually I've been the most contented in my life since I've had cancer, and that's a really weird thing to say.
Oh my God, absolutely. And I put shoes perfect, absolutely beautiful.
I didn't have a nice big wedding dress the first time round, so this is kind of the first time that I've actually got a wedding dress. So I think I'm more excited about the dress because it's the first time I've worn anything like this.
Alison's condition is terminal, but since she's decided not to continue with chemotherapy, anyone meeting her for the first time would think she was perfectly fit and healthy.
I don't look unwell. Nobody would know just by looking at me that I have a very serious disease. People don't understand that there are some things that I can't do. I can sit down.
Yeah, you want to sit down? Yes, sit down.
It's much heavier than I remember.
Yeah, because
I'm coming to terms with actually being not capable. Now that I do need people to look after me, I think that's been one of the hardest things for me.
The support she now relies on is another reason for the celebration she's planning.
All those people that are close to us and that have helped us through these last couple of years that, you know, haven't been so good. It's for them too, you know, it's a thank you for them, and it's a party for them to say, you know, thanks for being there and, you know, helping us out as well. It's absolutely smashing.
Yeah, absolutely perfect.
Yeah. Oh, really excited now. I've seen it with my shoes and my bag. I know everything matches. So, yeah, I'm thrilled. Absolutely thrilled. Absolutely stunning.
Oh, can't wait for that day now.
I do have plans for the dress afterwards because obviously with what I'm going through, it's highly unlikely that I'm going to be around when my son has children. So I'm going to make that dress into a christening gown, and then he can have that and use it, you know, in whatever way he chooses when he has children.
With a very different prognosis, Kevin and his wife are clear that chemotherapy is the right way forward for him.
Talking to the boss, we decided that, right, this is it, we're going to smash this chemo.
Hi Kevin, how are you doing?
OK, doesn't matter what they throw, just let's get on with it and do it.
Yes, fine. No signs of infection,
Nope.
any problems?
Nope.
Brilliant.
That's warm water, helps get the veins active so she can just jam the needle in without worrying too much. Like anyone who's just about to have a big needle chucked in them, it's a bit. But Amy's brilliant. Pay me later. But it goes in, they strap it down, and then you just forget about it after a couple of minutes, and that's just your day then. You're not going to be nervous now they're filming you, are you?
No, that's why I checked your hands first.
You got one go at this.
No pressure. We're in, okay?
Hardly felt that.
Done it a few times.
Yeah. Under pressure from the camera, though. That's pretty impressive, Aim. Pretty impressive.
The banter helps, but Kevin knows that a dose of chemo isn't to be taken lightly. And one of the drugs he's on needs really careful handling.
They have to inject by hand because it's so toxic. If it leaked out of the vein, it'd lead to skin grafts. It is that toxic. Then they hook me up to the bags, and for the rest of the day, I'm just on the bags. It's all good. These guys in here are just fantastic. Just put you at ease. They're running round, smiles on their faces, radio on, having a little sing-song. They're great, really great. I'm not just saying that because Amy's here. They're awesome. They really are.
The surgery to remove Kevin's gullet means that from now on, his daily pattern of eating will have to change.
Yeah, lovely. The esophagus is kind of like a reservoir. When you eat your food, that's where it hangs around. Because I haven't got one now. They've stretched my stomach up to make a little repository. So I haven't got the capacity anymore. So I've got to eat little and often.
Even on a lighter diet, the repeated doses of chemo often cause severe nausea.
Patients like Kevin, often we give them meds to go home with as well, so that the sickness is tackled on the day, and then if they were to have any when they go home, they've got something to help with that. So I'm just giving him his anti-sickness medications. Last time your epirubicin and everything was at 100%, we've gone down to 75%, so they've dropped it a little, so hopefully we can keep on top of the sickness.
Lovely,
then.
thanks Amy. My first 2 cycles went like a dream. It wasn't a problem, nothing at all. The third one, it was like all the side effects ganged up and just battered me for the third. Last one was just almost daily vomit. That's life on chemo, really. But I know it's for the best. It's helping me, so just got to get on with it. No point moping, just got to do it.
There's nothing for it but long hours on a drip.
That's it now. That's just me being bored for the rest of the day, just sitting here like this. There's no action-packed film today, I'm afraid. You've seen all the action.
And days of recovery at home to follow. Alison knows she has terminal bowel cancer. She's bought a special dress for a big wedding anniversary she's hoping to celebrate this coming summer.
Oh, beautiful, Alison.
Now she needs to know if her consultant thinks she'll stay strong enough to do that.
Hey, Alison. You all right?
Yes.
Lovely to see you.
Thank
all right.
you.
I've got Yusuf with me today.
We've been talking a lot about end of life, which is obviously a very, very difficult conversation to have.
You've always been very open in talking about, you know, what might happen towards the end as well.
He's very pragmatic, he's very open, which is great for me because that's how I want to be.
Palliative care is sometimes seen as synonymous with the last weeks of life. But in my years of working as a palliative care specialist, I've seen people for many, many years. It's not just about the last weeks of life, it's about the last years of life, and it's about making things a little bit better. We try to alleviate and improve suffering and symptoms such as pain, nausea, vomiting, breathlessness. And I think what we try and do in palliative care in particular is make sure that people realize that they're not alone in the world, that they're not the only ones who've gone through this.
The friends that would be around me at the end, I've talked to them as well, and they all know what I want.
Yes.
In facing up to her terminal diagnosis, Alison has made a brave choice about a dilemma none of us would wish to face.
I decided not to continue with chemo because it just made me feel so ill. While I was on chemotherapy, I had very little quality of life because I reacted so badly to it. I wanted to have as many months as I've got left. I wanted to be as well as I possibly could.
The pressure to fight and to destroy the cancer is always there. The choice seems obvious. Go for the chemotherapy, go for the immunotherapy, go for the radiotherapy. But a good oncology doctor will express to the individual that there is an option not to have this treatment. And that seems like a strange, quite nihilistic option, but it sometimes takes away the false hope, and it sometimes takes away the side effects and all the problems that are associated with taking some of these treatments when you are desperately unwell and facing the end of your life.
Still hoping to live long enough to see her big celebration, Alison has had a worrying setback. Severe back pain may indicate her cancer has spread and reached its final stages.
I think, I mean, the CT scan that you had not too long ago, that was fairly sort of inconclusive.
Yeah.
They didn't know if this represented new areas in the spine or whether this was something quite old and established, possibly even something sort of osteoporosis related.
Yeah, no, whenever anything's found, it is cancer, because that's just how things have happened with me, you know, all the way through.
Yes.
Oh, there looks like there's something on your liver, but we don't think it's cancer. It was. Same with the lung, now this.
Yeah.
Well, I kind of think, well, this is the end. But I also want to make it to next June.
Yes.
Because of, you know, my party, my 30th anniversary party.
Yes. Yeah.
So, I mean, you know, you're always the go-to person for my difficult questions.
Thank you. I don't know if that's a compliment or not.
You're the most straightforward person.
Oh, thank you.
I'm trying to get you to say, yes, you'll make it till June.
Yeah. OK, that's tricky. So, I mean, I wouldn't particularly make any amendments to your plans. I would really sort of work towards the June date. I'm not giving you particular clarity, but I suppose what I'm saying is don't make changes to your plans.
Kevin is also anxious. After major surgery and chemo to treat cancer of his food pipe, he's come to Velindre today, hoping to get the all clear from his consultant.
Hello there. Nice to see you again.
You too.
Yeah,
Okay.
good to see you. Good to see you. Nice to see you. OK, we're really, really pleased because it's been a really, really tough combination of treatment. You have not got cancer now, as far as we know. You had a cancer, we've now removed it, as far as we can tell. Because the operation you've had and, you know, the mechanics of where we've joined you back up, you know, that will be different, and you will need to learn new ways of eating.
He's eating so well.
Yeah.
In fact, I'm saying to him, hold on a minute, you're eating too much.
You have to go on a diet like the rest of us.
For him to turn around and say, that's it, cancer-free, you're in remission, that was probably one of the happiest times of my life. You value everything so much more because there was a time when you didn't think it would be there for long. What's the saying? All your Christmases have come at once.
Anyway, you should be a good cook now that all the cooking programmes you've watched while you've been home.
You're normally watching Coronation Street while I'm doing the dishes.
No.
Been told I'm cancer-free, in remission, call it what you like, it's a woohoo day. I'm completely done with treatment. And I am so grateful, humble, amazed by what Velindre has done for me and what they do for so many other people who've got to go through this journey. It's a hard, hard journey, it really is hard. But the top 2 inches, get that right, and yeah, you can be okay. So that's where I am now.
For Alison, the anxiety continues. She needs further investigation to see if the back pain she's experiencing is a sign that her cancer has now moved on to its final stage.
Alison's come in for a bone scan. She had an injection this morning with a radioactive isotope that's got a phosphonate agent attached to it that is taken up by the bones, so that when we put it under the camera this afternoon, we can view the whole skeleton, and that gives her consultant a full picture of what's going on. The thing with this scan is it will show up anything to do with the bones. That includes old fractures, arthritis, spread of disease, anything where there's extra uptake into the bones.
The facilities may be state-of-the-art, but Alison puts huge thought into every visit she makes to Velindre.
I'm a bit of a control freak. I like to have the sense that I can control things, and part of deciding what treatment I am or I'm not going to have is one of those elements of control, that the cancer is not just a bully and will take over my life.
You feel okay? You don't look dizzy or anything? No, that's fine. There we are then. You can sort yourself out there now.
Thank
All
you.
right.
knowing that you're not going to see your child get married or knowing that you're not going to see your grandchildren is a very, very difficult thing to deal with. So I thought I'd start knitting some items so I can leave them in a box for my son, so when he has children, he can give it to them and they will then have a piece of nanny.
Coming to terms with what she faces is part of what Alison calls making her new normal.
A new normal is very important to learn because I initially thought, oh, I would get everything over with and I would go back to my normal life. It takes quite a long time to realise that you have to make a new normal. How I've made my new normal is I've gone to my knitting, I look after my friend's dog twice a week. So it's all these things that make you happy. And I am contented in my life and I've made my new normal.
Every year, Velindre deals with 5,000 new patients. In this series, we've seen just a few of these ordinary people dealing with some extraordinary experiences.
When you're first told you've got cancer, it's such a big, big shock that you just can't believe it. I'm sure many people think, why me?
Didn't take it all in to start with. It didn't really hit home until after my first session of chemo. You see people going through it and you never realise how tough it is.
Did you speak to your son over the weekend? No, you couldn't. Oh, OK. All right.
Velindre helps many patients towards recovery.
I'm going to be home for the weekend.
Brilliant.
And that is something I never envisaged.
I know.
But it's an arduous journey.
My hair is falling out again. I can't actually pull it, and there you are, there's a nice handful of my hair.
And it reveals just how resilient the human spirit is.
Put the lipstick on, put the dress on, and we go again. That's what we do.
Whether it's helping people embrace a new phase of life or to face its final stages, this is a hospital of hope.
Velindre is one of the leading lights in the world for oncology and for palliative care provision. Where we're leading is on helping people make decisions and sharing those decisions with them, helping them to choose as wisely as possible. What binds all of this together is not necessarily the diagnosis, but the individuals that you have the privilege to meet. You often meet them at a very challenging time in their lives. And when you can make that a little bit better, that is one of the big rewards.
And for Alison, there's some news that brings hope that she may, after all, be able to celebrate her special anniversary.
Well, I've had the results of my bone scan. My consultant telephoned me and said that there was no cancer in the bones. So that is absolutely fantastic. I do have a little bit of osteoporosis, but I'm actually chuffed. I'm really chuffed.
Oh, Alison, absolutely stunning. Shall I bring your bag as well to see here? Oh, beautiful match together.
That's lovely.